I want to tell you about a woman named Evelyn. At 83 years old, Evelyn was exactly what many of us hope to be as we age. She was sharp as a tack, fully independent, and fiercely proud of her rose garden. Every single morning, before the sun could really settle in, you could find her outside, tending to her bushes or walking a steady mile around her quiet neighborhood. She didn't have any chronic pain, she had no history of falls, and she certainly didn't feel fragile. Then came a routine checkup. It was one of those appointments where everything feels perfectly fine, but the medical system is built to check specific boxes. Her doctor, following a standard protocol, suggested a bone density scan, a DEXA scan. It was framed as the responsible preventative thing to do, just a simple way to make sure her bones were staying strong. Evelyn agreed because she trusted the process, but when those results finally came back, they showed a scary number on a white piece of paper. It labeled her with severe osteoporosis. Suddenly, in the eyes of the medical machinery, Evelyn wasn't a vibrant gardener anymore. She was a catastrophe waiting to happen. The machinery of modern medicine started moving, and it moved with an incredible speed. A prescription was written immediately, and Evelyn began a treatment path she never truly understood. 6 months later, if you visited her home, you wouldn't find her in the garden. She wasn't walking her morning mile. Instead, she was confined to a chair, struggling to recover from a devastating fracture that the treatment itself might have actually invited. The original problem, her naturally aging bones, would likely have never touched her life. But the test did. It opened a door to an invisible danger, and it started a chain of events that she couldn't stop. I'm Dr. Victor Halston. I have spent the better part of my life in the operating room, witnessing both the incredible triumphs of modern medicine and the quiet, often overlooked aftermath of decisions made in haste. These are decisions usually born in a cramped 15-minute office visit where the person sitting on the exam table is treated as a collection of checkboxes and guidelines rather than a human being with a life already well lived. I've seen the results of these visits when they end up on my surgical table, and that is why we need to have this conversation. There is a fundamental truth that many in my profession are hesitant to discuss openly. The math of medicine changes as we age, and almost nobody tells you when it happens. When you were 50, the logic of early detection was flawless. It made perfect sense. You find something small, you treat it fast, and you add 20 or 30 years to your life. That logic is solid, it works, and it continues to work for people in their middle years. It is the cornerstone of preventative care. But somewhere along the way, the medical system forgot to update the rulebook for those who have reached 75, 80, or 85. We are still applying the same screening tools and the same aggressive intervention protocols to an 80-year-old body that were originally designed for someone decades younger. Here is the uncomfortable reality that isn't in the brochures. A screening that buys a younger patient 20 extra years might only buy an older adult 2. And the tragedy I have seen too often is that those 2 years aren't spent in the garden or at the dinner table with family. They are spent in a cycle of recovery, moving from one complication to the next, precisely because of the treatment that the routine test triggered. I want to be very clear about my intentions today. I am not telling you to stop seeing your doctor. I am not suggesting that you ignore your health or become cynical about medicine. What I am suggesting, what I am pleading with you to do, is to start asking better, sharper questions. We have to recognize that finding an abnormality and actually helping a patient are not always the same thing. Right now, millions of older adults are being pushed through a machinery of testing that was never designed for their age group, and the medical system is dangerously slow to catch up to that reality. It is time we look at the person, not just the protocol. So let's talk about the tool itself, the DEXA scan. In the medical world, we call it dual energy X-ray absorptiometry. It's a sophisticated piece of technology, and on the surface, the scan is completely harmless. There are no needles, there is no pain, And it only takes a few minutes of lying still while a low-dose X-ray passes over you. It sounds like the perfect screening tool. But the problem we face isn't with the technology itself. The problem is how our modern medical system interprets that data for a body that has been on this earth for 80 or 90 years. What a DEXA scan actually does is provide a mathematical snapshot of your bone density. It measures how much mineral is packed into a square centimeter of your bone. But here is the critical distinction that often gets lost in a 15-minute consultation. The scan cannot tell you about the actual quality of that bone or its flexibility. Think of it like a bridge. You can have a bridge made of thick, dense concrete that looks incredibly strong on a blueprint. But if that concrete has become brittle and lost its ability to give over time, it will snap under the first sign of real pressure. On the other hand, you can have a bridge that looks thin or has low density according to the measurements. But if the material is flexible and resilient, it will sway and hold under a heavy load. The DEXA scan only sees the thickness of the mineral. It doesn't see the resilience of the living tissue. Now, consider the 80-plus reality. When a radiologist calculates what we call a T-score, they usually aren't comparing your bones to other healthy, active 80-year-olds. They are comparing your bone density to that of a healthy 30-year-old at the absolute peak of their physical development. When you are 81, having low bone density compared to a 30-year-old isn't necessarily a disease. It is often a biological standard. It is a natural part of the human aging process, much like your hair turning gray or your skin developing wrinkles. Yet, the moment that number drops below a certain statistical threshold on a report, the machinery of medicine treats it like an acute emergency that requires immediate chemical intervention. This creates what I call a massive diagnostic gap. The scan gives us a number, and that number almost automatically triggers a prescription for a class of drugs called bisphosphonates. But here is the kicker. That number on a white piece of paper doesn't tell us if you are actually going to fall tonight. It doesn't tell us if your home has tripping hazards or if your balance is steady. It gives the doctor a convenient target to treat with a pill, while the real-world risks that actually lead to life-altering fractures remain completely invisible to the machine. Once that diagnosis of osteoporosis is stamped onto your chart, the next step is almost always a prescription. In the medical world, we call this the cascade effect. It starts innocently enough with a class of drugs called bisphosphonates. You might know them by names like Fosamax or Beniva. For a younger patient, these can be a helpful tool, but for an 80-year-old, the picture is far more complex. The first link in this chain often begins with gastrointestinal distress. I have had countless patients tell me about severe esophageal irritation, a burning in the throat that makes eating and swallowing uncomfortable. To a doctor in a rush, this sounds like a minor side effect or a small price to pay. But to an 80-year-old, it is anything but minor. It leads almost immediately to the next link, another medication to treat the stomach irritation. Now you are taking a proton pump inhibitor, which can interfere with how your body absorbs vital nutrients like calcium and magnesium. The very nutrients your bones need to stay healthy are being blocked by the treatment meant to save them. Then comes the final, most insidious link, the fear factor. Once you are told your bones are fragile, you start moving less. You stop tending the garden. You stop walking that morning mile because you are afraid one wrong step will shatter your hip. This lack of movement leads to muscle atrophy, and when your muscles weaken, your balance goes with them. The medication was supposed to prevent a fracture, but by triggering this cascade of physical and psychological decline, it has actually made a fall and a fracture more likely than it ever was before. You aren't just treating a number anymore. You are managing a new series of problems that didn't exist until you walked into that clinic for a routine checkup. This is how the system inadvertently trades your function for a finding. Now, I want to address something that is perhaps the most difficult part of this story to hear. And it is a concept that feels like a betrayal of everything we are taught about medicine. It is a paradoxical risk. To understand it, you have to understand that your bone is not a piece of dead wood. It is a living, breathing tissue. Every single day, your body is performing a delicate dance. It uses specialized cells to dissolve old, worn-out bone, and then it uses other cells to lay down fresh, new bone in its place. This process is called remodeling, and it is the reason your skeleton stays resilient and flexible throughout your life. When you take a medication like a bisphosphonate, the drug works by essentially putting a lock on the cells that dissolve old bone. On a DEXA scan, this looks like a victory. Because you aren't losing the old bone, your density number stays high or even increases. But there is a hidden cost. By stopping the breakdown of old bone, you are also stopping the body's ability to clear away microscopic damage. Over years of treatment, that old bone remains in place, and it becomes what we call hypermineralized. In the operating room, I have seen the reality of this firsthand. I have held bones that on paper had excellent density, but in my hands they felt brittle, almost like a piece of old, sun-dried glass. They had lost their ability to bend, which means they had lost their ability to absorb impact. This leads to a devastating condition called an atypical femoral fracture. This isn't a break that happens from a fall off a ladder. This is a fracture that happens while a person is simply walking across their kitchen floor. The thigh bone, the strongest bone in your body, simply snaps because the medication meant to protect it has rendered it too brittle to survive the weight of a single step. It is a rare side effect, yes, but when it happens to an 85-year-old, it is a tragedy that was entirely preventable. Now let's talk about what actually works. If we want to be honest about protecting your future, we have to look at the numbers that really matter. In patients over 80, a hip fracture isn't just a broken bone. It is a life-altering medical event. The statistics are sobering. Up to 30% of seniors who suffer a hip fracture will die within a single year from related complications. This is why we are so aggressive about prevention. But the question is, are we preventing the right thing? A DEXA scan measures the density of your bones, but density is only one small part of the equation. What actually prevents a fracture in an 80-year-old body isn't a higher number on a density report. It is the ability to stay upright. To put it bluntly, preventing the fall is what prevents the fracture. It is a simple shift in logic, but it changes everything about how we approach your care. The evidence for this is remarkably consistent across decades of research. If you want to protect your independence, the most powerful tools aren't found in a pharmacy. They are found in your daily habits and your home environment. First and foremost is muscle strength and balance training. Your muscles are the scaffolding that protects your skeleton. When your legs are strong and your balance is calibrated, you can catch yourself when you trip. A pill can't do that for you. Then we have to look at home safety. I often tell my patients that a single grab bar installed in the shower or a non-slip mat placed on a tile floor is worth more than a decade of bone density medication. Why? Because the DEXA scan won't tell you that your hallway is poorly lit or that your favorite rug is a tripping hazard. But that rug is what will break your hip, not your density score. Finally, we must address the internal factors. Are you getting enough protein to maintain that muscle mass? Are your vitamin D levels optimized? Most importantly, are you taking medications for blood pressure or sleep that make you dizzy when you stand up at night? This is proactive medicine. A DEXA scan provides a number that usually leads to a prescription. But focusing on strength, safety, and stability provides a shield that actually keeps you in your garden and out of my operating room. I understand that having these conversations with your physician can feel incredibly daunting. You don't want to be perceived as a difficult patient, and you certainly don't want to come across as someone who is simply refusing care. But I want you to shift your perspective. Asking questions isn't an act of defiance. It is an act of participation. It is the most responsible thing you can do for your health. When your doctor hands you that referral for a bone density scan or suggests a new medication, I want you to use one specific, powerful question. What are we looking for? And what exactly will we do if we find it? If the answer is that we will automatically start a drug that carries a risk of stomach issues or brittle bones, then you have the right to ask if the test is even necessary. Next, ask about age-specific risk. Don't settle for general statistics. Ask, what is the risk of this treatment for someone my age with my history? Most guidelines are built for 50-year-olds. You need the numbers for an 80-year-old. Then ask about the watch and wait approach. Active surveillance is not giving up. It is choosing wisely. Finally, ask the most revealing question of all. Doctor, what would you recommend if this were your own mother or father sitting here today? I have asked my colleagues this, and the answer is almost always different from the standard protocol. Your doctor works in a system designed for 15-minute speed, not nuanced conversation. Bring a written list. Bring a friend to advocate for you. If your doctor won't engage with your questions, that is a clear sign that they may not be the right partner for this stage of your journey. Now, before we end, I have one simple request for you. Do not try to fix everything about your health starting tomorrow. If you suddenly try to change your diet, your habits, your routines, and everything else at once, you will feel overwhelmed. And most people give up before they see any real results. Real, lasting health doesn't happen overnight. It starts with one small decision, repeated consistently until it becomes part of your daily life. So today, pick just one thing. Maybe it's working on your balance and strength. Maybe it's making your home a little safer. Or maybe it's simply paying attention to what your body has been trying to tell you for a long time. Which of these habits do you think you've been ignoring? Tell me in the comments. I read them. I also want to hear your story. Has a doctor ever recommended a test or treatment that you later questioned or even regretted? If this video helped you think differently about your health, share it with someone in your family who needs to hear this message today. And if you want more simple, honest health explanations like this, make sure you subscribe. Finally, remember, everything shared in this video is general information for awareness. It is not a replacement for your personal medical care. Always consult your doctor before making any major changes to your diet, medications, supplements, or lifestyle. Your doctor is your partner in this journey. Stay strong, stay informed, and stay in charge of your own health. Thank you so much for watching, and I will see you in the next video.